Good evening. Welcome to For the Record. Cancer is one of the 4 main non-communicable diseases in Fiji and around the world. And the disease is one of the most common cause of death and suffering in Fiji. I am joined this evening by representatives of Walk On, Walk Strong, the WOW's Kids Fiji, a charitable trust set up to provide awareness and support for children living with cancer and their families. Welcome to the show, the WOW's co-founder, Sina Kami, and Viola Lacey, WOW's team leader. And we will be joined later by Luisa Tangeda Kimbau More, the chair of WOW's Kids Fiji. Welcome to the show. Now, before we discuss the work that you're doing with WOW's Kids Fiji, let's talk in general about this disease known as cancer. You're not doctors, of course, but you've worked extensively in this area. So what is cancer and how does it start?
Thank you, Stanley, for having us here this morning. For me, as you mentioned, I'm not a doctor, but cancer to me is the disease that took the life of my child. And as we all know, it's all about uncontrollable cells growth, and anyone who have cancer, it's hard for them to explain what is cancer, and until you go to the doctor and they tell you all that. But for me, cancer is something that it's hard to cure, and but the work that we are doing now is all about trying to help the people, the children who have cancer. But I leave the definition of cancer technical to the doctors who will come and explain that.
It is when the Ministry of Health website says it's when cells in the body start to grow out of control. That basically is essence, and then they evade into other forms. Again, we are not doctors, but essentially it's when abnormal cells invade or grow into other tissues, and then they move into other parts of the body. How can we discuss what are the causes? How does it start?
Well, doctors lately, all studies, they haven't really they're not able to pinpoint the exact cause of cancer yet. But there have been a lot of factors that have been linked to cancer, such as the lifestyle. But for children, because we look after children with cancer, these children, they have not lived long enough to be able to take on the habits that it increases.
And this is despite huge amount of money and research that has gone into this. It's continued to vex a lot of medical experts in this area. Some of the list that we put down here is lifestyle, as you mentioned. But with children, obviously, they haven't had a chance
to get those habits. And also you have the environment. The environment they live in.
Like
also
sort of sun and UV exposure in some cases for certain. There's a wide variety and different types of cancer that's out there.
Yeah, and then there's genetics too, right?
Yeah.
That could be one of the factors that is linked to cancer in children,
Right. Yeah. Now there are different types. There's quite a lot of cancer actually. The Ministry of Health states that for men, liver, prostate, lung, stomach and colon, while for women it's cervix, the breast, the uterus, the ovary and the liver. What about for the work you're doing for children in Fiji? What are the most common types that you're seeing?
Well, based on the little children that we help, the most common one is leukemia. It takes on a large chunk of the kids, the type of cancer for children that we have in Fiji, and it's followed by bone cancer and brain tumor.
Please explain leukemia. What happens?
Leukemia is, well, like I said, I'm not a doctor, but leukemia is the cancer of the blood,
Right.
And it has a very high occurrence in Fiji, but it's wonderful work that is being done by the Ministry of Health, in particular the staff of the pediatric oncology unit. Before, the survival rates were extremely low, but now they've moved up. It was from 0, they moved up to 20%, but now the survival rate of leukemia in Fiji is up to 60%, and we thank them for the hard work they've been doing. And they have this twinning program. They work with doctors from Christchurch to help help
so
the cases.
Much has been said about how you can reduce it. People don't even know how to cure it. So again, what some of the issues that you mentioned, having smoking is one issue, having a healthy diet, having an active and maintaining a healthy weight, risky behavior, getting immunized, doing your medical history, and getting regular screenings. For parents that, obviously, how can they reduce the risk of cancer? Is there any way they can reduce the risk of cancer in the children, or some of the things they can do early, or some signs they should look out for to ensure early detection?
So, like we mentioned before, with children, we really can't tell what exactly is the cause, but the only thing that can be done, that's why we, for WOW's Kids Fiji, in collaboration with the Ministry of Health, we pushed hard to having a month to be set aside for child cancer in Fiji, and so for the first time we have that.
Right.
And for us, the important thing, the only thing we can do is early detection.
Yeah.
So we wanted the message
It's
of
pretty critical early
Yes,
detection,
yes.
because there's no cure. It's just
yeah.
to
No-
mitigate. I mean,
Okay.
your daughter Tai, for instance, it started off with a bleeding nose, didn't it?
Yes, it started off with a bleeding nose, and that's back in 2005. And when you go to the hospital, or they say it's normal bleeding nose, your child have a bleeding nose, but little did we know that it leads on to much bigger than just the bleeding nose. It was cancer in the sinus, and that's where we started. That's the beginning of our journey with Tai on
Right.
cancer. But those little, it's also on the early warning signs that we have now, working together with Ministry of Health. We are able to send out those early warning signs, that including the bleeding nose, right? And so hopefully, with working with the media and the people out there, that to send out all these signs for people to be aware of. Right?
Yes.
And I can say, it's like the continued unexplained weight loss.
Weight loss.
And headaches. Some parents say that they thought that the child is just pretending that, I have a headache, I don't want to go to school. But at the end, they found out that there was more than that.
Yeah.
And I think those are the, like increased swelling or persistent pain in bones, and or a lump on the neck, or those are the little things that maybe for
So parents need
for
to be a bit
parents
more
to
aware
be
of.
a bit aware of that.
Yeah.
If they complain once and twice, maybe that's the cue for you to take them to the hospital, right?
These signs, these are very common signs. High
Yeah.
temperature, tiredness.
It could happen for flu.
Yeah, it could happen for. So but parents need to know these signs. If they happen for a prolonged period of time, obviously something is wrong.
Something's wrong.
Yeah. So they
Take it
need to
for
take
check.
them. Yeah,
To
take
check,
them
yeah.
to the hospital.
You're watching For the Record. We're discussing the support for children living with cancer and the Walk On, Walk Strong WOW's Kids Fiji campaign. Will be back after the break. Welcome back. We're with Sina and Viola from WOW's Kids Fiji. Let's talk about how the charitable trust started. How did WOW's Kids Fiji begin? Sina.
In 2009, we started the WOW's Walk here in Fiji. Same day, it happened in Tonga. So that was the beginning of WOW's Kids Fiji. We started off with a walk. And until 2015, we registered the WOW's Kids Fiji here.
Now, the walk was because of your beautiful daughter, Tai, that was diagnosed, as you mentioned earlier, and eventually died from cancer. A painful experience for any mother. What was it like that made you made the commitment to walk on and walk strong on this journey?
It started off with, before she died, she made us promise her that we will do something with for the children with cancer, and that's how we started the Walk On, Walk Strong, and so on the day of her anniversary, on the first year of her anniversary, that's when we started the walk, and it wasn't easy. It wasn't an easy journey for us, but it was something that we know in our heart that she's gone, but it will help a lot of other children here, not just here in Fiji, but hopefully other kids from the Pacific.
What was it like for you when when you first found out that your daughter had cancer and the challenges that you faced going forward on that?
When we found out, that was after a whole year of so many operations, and it happened to be on the face. And when we were told after 5 operations that she has cancer, and you know, the normal question as a mom and the parents will ask, why Thai? Why us? And of course the question of, you know, and people raised, it's a, you know, the answer they give, it's a curse or something you've done. But in her case, she was the one who came out strong and said, Mom and Dad will be okay. And that was the beginning of we see something that is different, you know, from, it's not the normal sickness that we are, you know, that she cried. No, she said, we'll be fine. And that's from how she started writing her blog, doing her journal, and start writing her song.
And eventually that song, which is Walk On, Walk
Strong.
And the 9th anniversary of Thai's passing was last Wednesday, and I understand today is the 9th anniversary of her funeral, today the 20th, correct?
Yeah.
So what does the day mean for you in this 9-year journey that you've made, Sina?
Yes, sitting here today, certainly, it was nothing that we expected. But I believe that even though 9 years she is gone, but we have so many other kids out there who need our help. And I think that the message of today is just to the parents who are going through tough time, that the storm never lasts. And we have to walk on and walk strong.
Yes. You, the fight 9 years later, Viola, how strong is it?
It's still going on strong. The Thai's message is just universal and cuts across the age group. For someone that that lived for only
It's a
15
message of
years,
inspiration.
Yes, it inspires everyone. It sort of, even the first time I heard it, I said, I need to give back. I need to make myself useful. It just inspires everyone to to help children with cancer. These are little children. They need us adults to be their hands, to be their feet, to be their voice. And it's still going on strong. WOWS, we're able to do the work we do with our volunteers. And these are all, everyone in WOWS, they are all inspired by Thai's message.
She's an inspiring story, and the expression and the emotion, the passion that's there, we've just seen from you, Sina. There's been other inspiring stories over the years with the WOWS campaign. Can you tell us some of the inspiring stories that you've also come across doing the WOWS Kids Fiji?
Yeah, I think the story that we, of course, we remember Thai and her message that passed on, but we met a lot of families and children who have their own story to tell. That inspired us to move on with what we do. And we've seen the pain that the parents are going through. That inspired us to go through. We go into houses of parents who look after their children. It happens to the poorest among the poor. And that's what makes us, it inspired us to move on with this,
people with much less resources,
with
with
much
bigger challenges to
and
take on.
yes, and that what touches our heart. That these people need our help. And it's not just the WOWS. We were not able to do this without the support of the public, and working together with the Ministry of Health, and also we have the support with the Fiji Cancer Society also.
So there's some key challenges, Viola, with families that have children living with cancer. When there's more children and parents, they have to be there with the child, but they have children at home. What are some of the issues that's particular to those families with children living with cancer?
I think the main one would be financial challenges. Like I said, based on the children that we work with, most come from low to no income at all. And in certain cases, you have just a parent that is working, the only one parent that is working, and then the sick child only wants that parent to be with her in the hospital. and so the parent has to leave work, and we thank our supporters over the years, enabled us to offer the kind of support that we offer them.
It's a very deep emotional
Yes.
issue, more
Yeah.
than just a health issue in this case.
Yeah.
But so, from your experience, for those out there, some of your advice to families or parents with children living with cancer. I mean, apart from WOWS, where can they go to for support right now?
Right now, for cases, for child, to be specific, there's none. There's no other places in Fiji where they can go for with regards to child cancer. But for other genital disease, you have Cure Fiji. You probably can get some help from Save the Children, but
So apart from the government's health
Yeah.
service, in terms of support this for children right now, there's only WOWS Fiji.
yes, can say yes.
And what are some of your advice before we go to the break, to from your experience, Sina, to the families out there with children living with cancer? What is your message for them?
I think the message that we'd like to leave with the parents who are going through, cancer with their children is to just to walk on and walk strong. The Ministry of Health is there. We are there. And we have all the support from the public, and together we can help the child, right? And also their family. But I think the most important thing is for the parents to accept it. That your child is sick, and we have to go to the right places to find help. And with our message, that's all we can give, and also with the other services that we provide for them. But the main thing is for them is to walk on and walk strong.
Keep going.
Keep going.
All right. You're watching For the Record. We'll be back after the break. Welcome back. You're watching For the Record. We're joined now by Luisa Tangidaki Maumode, the chair of WOWS Kids Fiji. Now, for the first time in Fiji's history, the Minister for Health launched August this month as Child Cancer Month. Quite an achievement. How much effort was put into making this happen?
Thank you, Stanley. For us, it didn't really require much effort because we have existing partnership with the Ministry of...
But it's taken so long.
It has. For an organization, it's not easy to just set up and operate from the get-go. We've had setbacks in the beginning, but I remember that setbacks are always a setup for a comeback.
Right.
Given our situation, we came into, we started operating in Fiji through partnership with the ministry, with the Fiji Cancer Society. I'm not going to dive into the details because that was widely publicized.
Yeah.
A lot of people are aware of the nature that surrounded the situation that we had. But there were positive outcomes that emerged from that, and one of it was...
It made you stronger.
It did, but not only that, we were able to set up an organization. We were able to register, and we're still here. We're here for the long run as an organization, promoting the work on child cancer, and we're here to stay.
Right. And this announcement, something like this, how does an announcement like this, like declaring August as Child Cancer Month, what does an announcement like this mean for your efforts for kids living with cancer? What difference does it make, Sina?
It does make a big difference, because in the past years we tried to go with the International Month of Child Cancer, America, New Zealand, that's when they celebrate March or February.
Yeah.
But to have our own Fiji Child National Child Cancer Month, it says a lot to the parents and the children that we do care. We have a breast cancer month, we have the prostate cancer month, but when the kids hear that, oh, there's a month here in Fiji for us. And
especially going through the conditions they're going through.
Yes, and if you try to, we talk about cancer and that, but we always say that the pain is still the same, whether it's adult cancer or child cancer, but it means a lot, not just for us as a foundation or just the Ministry of Health, but it's for our patients and their family also, that we raise that voice that we do care.
It's just the first one, but how would you like to see it being transformed and become more of a very big awareness thing in the future. Luisa.
Thanks, Stanley. We see it as something that will be here for the long term. And we look forward to consecutive declarations for Child Cancer Month. And that's probably why we've got a golden pin here. It's gold, it's durable, and it's something that's here to stay. And it represents and resonates with the message that we're trying to promote. Just the fact that we have a month to focus on child cancer is special because it progresses the work that WOWS does.
Yes.
And
So-
progresses the cause.
Yeah. And so, how much work do you do in collaboration with government?
A lot. A lot. We have sitting in our board doctors from the oncology unit, and they're the ones that provide advice. We are constantly collaborating with them on a daily basis regarding the kids who are being brought in and are under review at the oncology unit. Very regular visitations by our team leader to visit the kids.
So there's a partnership there.
Daily.
There's a partnership there, but is there other things that you'd like to see improve to raise more awareness and improve on the services for treatment of children living with cancer?
I think dealing with the government, of course, that we have the Ministry of Health, and to raise awareness. Apart from just us in the Ministry of Health, we would be like to see, from like with the Ministry of Education, that where we can, because our target is the children, to raise awareness on that, on how can we work together with the Ministry of Education on raising the awareness on or have these early warning signs go into schools and also do the BTA meeting and stuff. So I think with the working together with the government on other different levels will also help us get the message out and the early warning signs that help our children.
It's critical. Now, you mentioned earlier, and I'd just like to touch on it a bit, because people may have questions. The trust faced a lot of challenges, starting off in its early years. At one point, funds were frozen. You could not access those funds. Then you registered the trust on its own. So we don't want to go deep into it, but what have been some of the lessons learned into starting something like this?
Quite a lot. I think WOWS were out by 2 years. Not out in terms of absence, but we just thought, okay, for once, we'll just focus on getting ourselves organized. We're pretty lucky that the same board that we had back in 2009 that actually set up what is now the organization, they're still here. So we have some committed members who've been with us since the beginning. And I see that going forward, it just means that we're not in it alone. That WOWS really is a message that resonates with everybody, that nobody is walking alone. But we all need each other. We all need the partnership. We need government.
You're also
and
much
PG.
better structurally
Yes.
in some ways now.
Yes. So internally, that's been part of what we're doing. Now that we have an organization in place, we're looking into strengthening our systems.
So what are your challenges now?
Our current challenges are just improving our financial systems to be able to support the great work that we're doing, and improving some of the services. There still are gaps as organizations, as it exists with certain organizations, but part of why we have each other is to constantly improve on the gaps.
Yeah. So what would be some of we mentioned about government policies that you're working with government on, or some of the government policies that WOWS Kids Fiji would like to influence or see in place?
Yeah, I think with the national child cancer policy, that was the work of all the doctors who has been working with us, and we come on board as partner with them on that. And I think with what the doctors is trying to say, that there are different policies for other health issues and stuff, but to have our child cancer policy that guide us and lead us, and how can we improve on the services that they do here locally, and how can we also include helps from other from overseas and other partners.
All right, You're watching For the Record. We'll be back after the break. Welcome back. We are discussing the issue of treatment for kids living with cancer with WOW's Kids Fiji representatives, Sina, Luisa, and Viola. Let's talk about the treatment and care required for children living with cancer. What are some of the key issues that you are facing in assisting in the treatment and care of cancer patients?
Thank you, Stanley. Some of the key challenges that we've found based on our experience is really reaching those kids who come under our radar. Not everybody is based in Suva or based in areas that are
You're
close to
mainly
hospital.
based in Suva?
We are.
Okay.
We have an office at 251 Railway Street, but our services reaches out to outer islands and children who are based in areas that are very hard to get to. So part of the work that we're doing on a daily basis with the oncology unit is just exchanging information about who's there, which kids are there that need our assistance. So we've got transportation. The funds that come into WOW's support the transportation costs of these kids to be able to attend their reviews whenever it's scheduled in hospitals. So we've got local support. We've also got overseas support. But local support in particular covers transportation, the costs of their daily requirements, toiletries, food. Some of these kids require specific care. We've had situations where some kids have had to be provided cylinders for oxygen.
Right.
You know, it's not something that's easy to purchase. It's very pricey. We've had kids who have required medicine that would cost over $1,000. So those are some of the assistance.
So high costs of medication.
High costs of
and stuff.
medication.
For a child, you talk about services reaching out to the outer islands. For a child living with cancer, diagnosed with cancer in the outer islands, what kind of service would you typically provide for someone from there?
Mainly transportation costs.
Transportation.
Yes.
That's the major one for
That's
them.
the major one.
Access, to provide access
Access to it.
So for a child that's living in Lambasa and in Suva, do they have different
They have different
levels of
needs.
access? Eh?
That's right.
And I think also, and it's not just the transportation coming from, because we take our cue from the doctors. They will contact us. We have a child coming from Lambasa or South Savu. Can you guys take care of that? And when they get here, if there's no accommodation available for them, then the doctor will inform our team leader they need accommodation, and that's when we step in with that. Phone cards if they need that, you know, the like what Luisa was saying, the voucher that we help with. And if there is any medicine that the doctor says it's not available at the hospital, then they will contact us and see if we can support on that.
Right.
So
what's the main challenge in being able to provide services in other areas? Is it cost or resources? What's stopping you?
from
Like from
helping-
having, you're based in Suva, from being based, say, in Lautoka, in South Savu, in Lambasa, what are some of the
Yeah.
issues that's
I think like we're saying that because we don't go out there and look for them, and it depends on when the doctor call us. We have a case from these places. Can you help us? So the two main.
So the doctors actually call you. For
Yeah,
this
they are the one. We work closely with them.
And
They
if
are.
I can ask very quickly, what numbers are you looking at? Like, do you have such a rough idea of the numbers of children?
We're looking at about 35 in Suva
Right.
and 23 kids currently under our care in Lautoka.
From Lautoka, and those are
This
the
year.
two main hospitals that we work with, and so we have patients from Ba area and all that. They come to Lautoka, and some come to Suva. So that's where we deliver our services to.
All right. WOW started in Tonga with Thai, of course, and then moved to Fiji, which got a very strong presence, and as you mentioned, one of the only presence in terms of support for children living with cancer. Are there plans to take the good practice that's being done here to other Pacific countries?
Yes, and that's, I think if we go back to the interview that we did on the first anniversary thing, that was the plan. And we're hoping that with, as we continue with the work here in Fiji, we'll be able to go into Papua New Guinea, Vanuatu, Samoa, with that message of hope. It's just a walk on, walk strong, and whatever we raised in that country stays to help the children. And I think it shows when we had our first child cancer conference, Pacific Child Cancer Conference here in Nandi, we were able to co-sponsor with the team from New Zealand to bring the doctors from other Pacific islands. And it was highlighted that only here in Fiji, and also they have a child cancer in Tonga, that they are the main supporters for the child cancer. At the same time, Samoa and Vanuatu, when they all got up and say, can WOWS come and because they don't have a child cancer for their children in their country. So we're
WOWS
hoping.
has been pretty groundbreaking in many ways.
Yeah,
Eh?
yeah.
You've initiated over the years quite a number of interesting awareness and fundraising events. There's the Shave or Save, the SOS, that had a lot of celebrities losing their hair, and the WOWS Walk, the WOWS concert with the Laughing Samoans. Please outline, how these have worked in terms of raising awareness and raising funds.
It's really progressed our cause. It's provided that platform where WOWS is able to put the brand there, and it gets the interest of people. Everybody asks, what is WOWS? What is WOWS? It's a very catchy word. What does it mean? The message resonates with people, and it's not just for those people who are going through cancer or children with cancer, but it's everybody who's going through any tough situation. The message is, it's clear as it is, just based on Ty's clarity of who she is, who she identified herself with in Christ. And I guess that's the message that is able to shine through whatever challenges that we face going forward and to progressing the cause of WOWS and the focus on child cancer. We're really here for the long term. I don't think anything is going to erase the existence of WOWS, but we may not all be here, but hopefully that we do hope that others will come on, join the cause and take
Right.
on.
9 years and still going strong. You're watching For the Record. We'll be back after the break. Welcome back. You're watching For the Record. Now, WOWS Kids Fiji, 9 years and amazing work and still going strong. What are some of your next initiatives and fundraising that you're organizing?
Thank you. As we've discussed, it's the month for child cancer awareness. So for the remaining days of this month, we'll have advertisements that will run extensively through Fiji Times and also with the radio stations for CFL.
What are the advertisements saying?
The advertisements will be focusing on the early signs of cancer.
Yeah, which is a critical issue.
Yes, that's why we wanted the Child Cancer Month in the first place, so that message is clear and out to everybody in the public, so it eventually becomes common knowledge. And then we're having a Shave or Save again this year.
Again?
Yes, we are
So
thankful.
some people be losing their hair again.
Yes,
Yeah.
we are thankful to Div the
Not
Modder.
some, a lot of you.
Yeah. So we're thankful to Div the Modder for taking up the challenge again. He's got his campaign going. And also we have a newcomer this year's BSP. They also have taken up the challenge this year, and there's a few more individuals who have started to show interest.
So how do people get involved?
So they contact us directly through our Facebook page or through email, and they register. And in the registration, they also state the amount, they pledge the amount they'd like to raise. So if they are able to raise the amount they've stated, then they shave. If they don't, then they keep their hair.
All right.
Yeah.
What was the significance of shaving for those that may not know, Sina?
Yeah, I think it's a simple that goes with when you have chemo and you lose your hair. And I tell you, the first time I joined the Shave or Save, and for us ladies to lose your hair like that, it's only if you go for chemo. But when you take up the challenge and you sit up there and they shave off those, the hair and stuff, you remember what your child went through. And those who came on board with the Shave or Save, they remember their mom You know, they remember their loved ones during that process. It's not an easy thing to do, but you can't put a price on those, you know, and on that. But that's the idea of have the shape or save. You either it's just the support, the support, and
you also have this WOW's Wonderland Ball planned for the 2nd of September.
Yes.
What's happening there?
We have a theme. It's Wonderland because, you know, we look after children with cancer. We like to keep our themes to be kid-centric. So it's like Alice in Wonderland. So inviting everyone to come if you can. We have wonderful prizes. We have wonderful sponsors that have come on board. Door prizes and wonderful entertainment for the evening.
Right. 2nd of September.
Yes.
All right.
Before that, we'll have a panel discussion. That'll be on the 29th of August. Just stakeholders to discuss child cancer-related issues.
So the funds that you raise from these events, what is that used for? What has that been used for? How is that being used, Viola?
Like we can all agree that child cancer is very distressing to everyone involved, from the parents to the friends of family to the child cancer doctors and nurses. So for WOWs, we are very much, also they are mentally and financially and emotionally straining.
Yeah.
So for WOWs, we are committed to easing that pressure off a bit off the carers so they can focus on looking after our little champs. And they've mentioned that already.
There's no medical cure, but you try and ease
help
any
of those strains. And the funds goes into what they've mentioned, transportation, accommodation. I think they also, the other thing that we also help with in situations where we have lost some of our children, we also help in finance.
In that regard. We are down to 60 seconds, and I click this time. Sina, what's your main message that WOW's Kids Fiji would like to leave behind for people who are watching this program?
I think the message is for this month is for people to join us and walk with us with our children by raising awareness, talk about it, that cancer, it's happening here in Fiji.
It's a reality.
Yes, and also the message is for the people out there. We just want to say thank you. Without their support, we wouldn't be able to do this. From young to all the grandparents and all the different business houses, we just want to thank you, Ministry of Health and other Fiji Cancer Society and the public. Just want to thank you. And I think the message we always talk about is that the storm won't last too long, and we have to walk strong with our children. And I think it's all about the faith, journey of faith, and that's what makes us come this far. And it's with that faith and holding hands with other people, we are able to help these children who needs our help.
And all move forward together. Sina, Luisa, and Viola, thank you for joining me on For the Record.
Okay.
That was the show for the evening. We hope you enjoyed it, and you'll join us again next Sunday. From me and the team, good night.